Thanks a lot for staying with us here at CNN News 18. I am Ridhima Bhatnagar. If we thought that COVID is behind us, well, the numbers from China are telling us another story. Videos emerging from China show that cases are doubling at a rapid pace. The medical infrastructure is overburdened and cremations are happening 24/7. The worry for us here in India is, what about its global fallout? Pressing into action, the Prime Minister has also chaired a high-level meeting asking states to increase their vigil and for people to go back to the basics. The variant that seems to be behind this surge is BF.7. So we will help you understand what we know so far about this variant, how does it act, how is it different from other variants, and more importantly, how should we prepare ourselves? So we will decode this variant BF.7 for you. We'll help you understand what this variant is, how is it different from other variants, what are the symptoms, and more importantly, are our vaccines, do they have their efficacy still intact as far as this new variant is concerned? So let's really begin with what do we know so far about this BF.7. It's a sublineage of the Omicron variant BA.5. What else do we know about this variant? It's the strongest infection or reinfection ability, and that is why it is causing a bit of panic as far as at least China's numbers are concerned. The other concern is this variant is highly transmissible. There is a shorter incubation period as well. Higher capacity to infect those already jabbed, and that is why the efficacy of vaccines becomes very, very important. But we also want to now talk to you about what are the symptoms. How will you know if you've been infected as far as this variant is concerned? Upper respiratory infection and fever, something that we've seen in the past variants and past waves as well. Something again similar is that you'll have a sore throat and a runny nose as well. What we're also understanding is this will also be followed up by cough, congestion, as well as body fatigue. Something again similar to what we'd seen in the previous waves and the previous strains as well. Let's also now talk to you about where all these variants have been found so far. China, of course, as I said, this is where the scare actually began from. Here we're understanding there are cremations happening 24/7 because we still don't know the exact numbers. Cases also being detected in Japan, in South Korea, Brazil, United States, United Kingdom, Belgium. Unfortunately, cases being detected here in India as well. Then you have Germany, France, and Denmark. At least for India, the biggest concern as of now is that should we actually ban flights? What should we do as far as testing is concerned? So the question that we're asking this evening is, how severe is this new strain, which is now called BF.7, and how should we prepare ourselves? Let me also now bring in our guest to really help you understand what are the kind of precautions that you should take. We have the chairman of Nephron Clinic, Dr. Sanjeev Bagai. We also have Dr. Satyanarayan, head of pulmonology at Manipal. Good to have both of you on the broadcast with us. Dr. Sanjeev Bagai, I'd like to begin the conversation with you. Understandably, a lot of people are concerned today. They are worried today. So let's begin with the basics. What is the kind of information that we have about this variant?
Hi, good evening. So most of the information is either from the Western countries or mainly now recently from China.
Sure.
So just to put things in the correct framework, we have the original Omicron, which we call as the parent strain, and then it had new sublineages, which we call as BA.1 and BA.2. It was BA.2 which actually further divided into BA.2.75, BJ.1, BA.4, BA.5, and so on. Now, in the entire gamut, the lineage which we are seeing now as what we call as BF.7, it's actually a breakaway from what we call as of BA.5. Now, in this entire thing of what we are seeing from China is because the vaccines there didn't work. It has very poor efficacy.
Yeah.
It failed because the population was largely guarded They were unexposed to the virus. There was no community acquired immunity. There was no concept of herd immunity. And suddenly this new wave came, which is more invasive, which is highly contagious. It spreads much faster than the previous Omicron sublineages. And the comorbids and the elderlies who were practically unvaccinated without any boosters were sitting ducks.
Right. So, you spoke about the vaccine, and I'm just looking at some efficacy as far as Indian vaccines vis-a-vis the Chinese vaccines. We're understanding Covishield and Covaxin efficacy has been proven. There is a 76% protection against severe disease for people up to the age of 79, 67% effective in protecting people against severe disease over the age of 80, and 85% efficacy to prevent these deaths. But essentially, Dr. Bagai, what I'm trying to understand, for all of us, we took our boosters almost a year ago. Will they still be holding? Will that protection still be there?
Yeah, so there is a decrease in protection in terms of efficacy of the vaccines because it escapes the vaccine and the monoclonal antibodies. That's your antibodies in the body which we give as treatment. And the recent studies have shown it can escape it up to 165 times more than the original strain. But having said that, both the vaccines in the Indian shows, which is Covishield and Covaxin, are holding very well. We have seen practically no admissions even with Omicron or with any other strains of Omicron, including the recent ones, what we are seeing. All we need to do is to wear a mask, get yourself vaccinated, including the booster dose, and make sure that you avoid crowded areas, avoid coming in contact with people with cold, cough, fever.
Right. Dr. Satyanarayan, I'll like to bring you in the conversation as well. When we say this is highly transmissible, there is a shorter incubation period. What does that then mean as far as the severity of the infection is concerned?
So from the moment of contracting the virus, the time taken to exhibit the symptoms of illness is going to be a little shorter, but I do not think that it matters. Now, the current calculations about infectivity is that one person gets infected with BF.7, the chance is that he is going to infect 10 others. Now, even that may not be that important. In the sense, this virus, we need to look what it does in the Indian scenario. Our native population has herd immunity to some extent.
True.
The innate immunity is geared up and prepared to face the virus and its grandkids and grandsons or stepsons. So, in a way, we are better prepared. So, the symptoms may be totally different in our population subset.
Okay.
However, as my esteemed nephrology friend was aptly advising, I think it is important to look at two dimensions here. One is epidemiologists and clinicians will look at the rate of infection, the clinical picture.
Okay.
The government is very serious. We have all learned the lessons from the last four waves. So the central government and state governments are coming up with the guidelines. The technical advisory committee in each state is activated. So government has cut out few areas to work upon. But
sure. But Dr. Satyanarayan, it's nice to hear when you say that, because we have herd immunity, so the hope is that we won't see the kind of numbers that China is seeing. But what I'm essentially trying to understand is, and this is what we have learned over the past few waves, you'll be able to help us understand better, that no two countries peak at the same time. There are peaks at different times. So if China is seeing the kind of cases it is seeing today, what is the kind of estimates that we're working for India?
So the point is very clear. See, if you look at first wave where there was no vaccine anywhere, our strategy was to delay the time to the peak. Therefore, we don't overwhelm the healthcare setting and bed availability, crunch of beds in critical care, all these things. We did succeed to a large extent. We could delay the time to peak. But at the peak, no matter what is the amount of beds, you will never be able to house an entire city into the hospital. That is different. But The point is very, very clear. We have faced Delta, we have faced Omicron, we have faced the original COVID-19 virus from 2019 July onwards. So we have also faced, after Omicron, we have faced the fourth wave. All the 5 variants, BA.1 to BA.5, we have faced.
So, of course, we are better prepared, and that's what a lot of experts are saying, and that is why we're seeing the government also press into action, asking people to go back to the basics, increasing vigil on the ground as well. But despite all of that, as a medical expert, if you look at the rate of people who've taken the booster dose or the precautionary dose in India, that's actually not very high, not very optimistic. How crucial is to take that booster dose at this point?
Overall, it's less than 27% vaccination rate as reported from China. Figures are not reliable. We as a country, we have done best in terms of at least 1 vaccine. We have done best in terms of 2 vaccines. We have not done that well with the booster dosage. So this will be a clarion call for the population at large. If you have not taken a vaccine, say second dose or third dose or precautionary dose, please go for it.
Sure.
What is the purpose behind that? The purpose is very simple. When you take the vaccine, you develop not only the sum total of all antibodies, you develop a small group called as neutralizing antibodies. Now, scientific studies have pointed out they may stay for 4.5 months at the max. Beyond that, you may have antibodies of the IgG which you get checked in a commercial lab, but your immunity will be next to nothing or something like that.
Sure.
However, you have a different arm of immunity called the T cells, which have long-term memory of what this culprit virus or its family generation looks like.
So the advice that the medical experts are giving is still very simple, and this is what I'd just like to reiterate as I wrap this conversation, Doctor, for our viewers, is we have to go back to the basics. We have to wear a mask, we have to sanitize ourselves, and if we haven't taken that precautionary or that booster jab, we need to take it now. We're not trying to create panic, but it's always better to be prepared. Doctor, we appreciate you taking out the time and joining us here on CNN News 18. We want to now shift our focus to the larger global aspect of what's really going wrong in China. Now that we have a better understanding of what the BF.7 variant looks like, let's really understand what's happening in China. It all started with a tweet that was put out by epidemiologist Eric Fiegel-Ding, who said what is happening in China is thermonuclear bad, as infections could wipe out 60% of Beijing's population. He said that crematoriums in Beijing are full and cremations are happening 24/7. The official picture is very different though. Officially, China's National Health Commission has put out the total number of COVID deaths in the country since the beginning of the epidemic in January 2020 at 5,237 and the number of confirmed cases of the disease at 380,453. But the numbers are a small fraction in comparison to what the reports are coming out. So why is China unable to control COVID? What has gone wrong as far as the zero COVID policy is concerned?
Every day there were about only 300 bodies got burned, cremated per day. Now all the crematoriums are operating 24 hours.
So let's really break down the details in terms of what's happening in China and why should the world be alarmed. But first, let's break down the details and what really led to the explosion and why are we seeing the kind of numbers that we are seeing in China. The first is the surprise truth about the origin, cases, as well as deaths. So any number that's coming out of China has to be taken with a pinch of salt because it won't be accurate. As far as the zero COVID policy is concerned, there is a lot of criticism around it. They eased the lockdown and enforced the zero COVID policy, one of the most extreme measures that we'd seen across the globe. Didn't really react promptly to the initial spread of the disease, which of course has been the biggest criticism as far as China is concerned, that if the world knew about it at an earlier time, we could have tackled it much better. The lack of transparency over the vaccine efficacy, most experts today saying that the vaccines that the Chinese are using, their efficacy is under question, and also the low vaccination rate, especially in the age bracket of 80 and above. So as I said, this of course is problematic. There is no proper age-wise vaccine coverage formula as well. But let's also now talk to you about some other details in terms of a comparison. Because we are saying that the worry today for India is, can there be a global fallout? So what is India's position vis-a-vis China? India, vaccines effective on all age groups. Their efficacy is much higher, as I spoke to you earlier in the show. China, vaccines less effective on older people. And as I said, the number of people who've taken the vaccine in that 80 plus bracket is also very, very low. As far as India is concerned, vaccines provide 76% efficacy on old people. But compare that to China, just about 30% jab efficacy against severe diseases in the elderly, and that is why the high death rate as well. Let's come back to India again. Proper age-wise vaccine coverage formula. For China, jab coverage high among the young compared to that of the elderly. And again, the zero COVID policy, not keeping transparency in terms of numbers, trying to hide the numbers, all of that has gone against China today. With India, immunity better with 45 million cases till 20th of December. But China, strict lockdowns mean lagging on immunity. There is just no herd immunity, and this is what most experts are pointing to. If you come back to India, acquainted longer with the new variant. With China, unexposed to variants owing to the zero COVID policy because people could just not escape either their houses or the isolation centers. So the larger question is, why can't China really control COVID, and will that have a severe global fallout for countries like India? Let me also now bring in our guests as we wait for Jennifer Zeng. We already have Dr. Sanjeev Chobe, consultant at Suntech Hospital. So good to have you on the broadcast with us. Of course, the world is baffled once again. If 2020 wasn't enough, why are we seeing this cycle again? What really is happening in China?
The lockdown was imposed in 2020 and they suddenly eased out the lockdown in 2022 in October, you could say in December. So what happened exactly, the maximum waste and the maximum damage was caused by this Delta variant, which was like super spreader all over the world. Since they have opened, they are facing only the Omicron, and since the number of cases are high, people are getting panicked, and there are certain issues. Definitely, the medicines are out of stock, and COVID, the fever clinics are overbooked, and the OPD and emergencies cases are completely covered because the whole hospitals having their own capacity. And the actual is not only in Shanghai; it's all over the China, including all the provinces, including Beijing, Tianjin, the Kunming and Guangzhou, Shenzhen. And this is the scenario. But the more about this, first of all, there is a patience. The number one problem was the patience, because people are waiting for 3 years, and suddenly the government has opened, and then it was all started getting, like, people started interacting and mixing each other, and then this was spread it very quickly because the ratio is 1:16. One can infect 16 people. Traveling rate was also very high during that time after the lockdown was eased out. So because of the intermixing, it was spread slowly all over the places in China. So that is the main reason for that.
Right. Currently, what is the picture like? We are understanding that cases are spreading at a very fast pace. The doubling rate is extremely worrying. Do we have a sense of numbers of how fast the infections are spreading?
Numbers we exactly don't know, but yes, I can say in Shanghai, you can say it's around 50% and plus, because the population of Shanghai is around 330 million, that is 3 crore. So that is, you can say 50% is 1.5. So definitely it's a very high number of people are getting impacted.
Okay, so I want to understand, where did things go wrong? Is it just the zero COVID policy which needs to be blamed as far as what is happening in China, or is it more than that?
No, you need to understand all these things. See, the main phase was 2021, which was the Delta virus, and the Delta was gone. And if you consider the coronavirus in the center, and Delta was next to this, and Omicron is very far in terms of fatality and mortality rate. So they open in a very sense, very carefully, because they thought that this Omicron will, even in fact, the mild symptoms will come out.
Okay.
And mild symptoms will come out. And definitely you can see we are facing the patient with the only fever, cough, cold. But there is the only problem is that, in India, even the OTC medicines, the over-the-counter medicine, even the fever medicine, and all things are restricted. That's why the chaos has been reached, and medicines are out of stock. Even from our hospital, we can detect, but we are not dispensing any medicine at the moment.
So what I essentially want to understand, what is leading to such severity of the infections and the deaths as well? Is it just because people haven't taken the vaccine, or is it the efficacy of the vaccine that isn't working?
Vaccine has nothing to do with that, because the vaccination program was started in 2021, and most of the people, including me, receive my third dose in September 2021. So there is nothing with the vaccine. The problem is, if you see, not only in China, you can see other countries also, they have the research, like Australia, Japan, and US, UK, everywhere. So, but yes, they have a mild symptoms. Now the question is, regarding vaccine, we don't have any accurate data at the moment that we can say what is the efficacy of this vaccine. And second, old patients who having they are receiving chemo, they are having a dialysis for twice a week or once a week or thrice a week. These people are more actually vulnerable and fragile. That's why.
And this is something most experts had said, even in India in the previous waves, that people with comorbidities are at a higher risk because, the infrastructure is also divided and they might not get the kind of attention that they require. We also have Jennifer Zing, Chinese whistleblower, human rights activist, also now joining us on the broadcast. Jennifer, good to have you with us here on CNN News 18. We, of course, have been seeing the kind of videos that you're putting out, but the world is still trying to understand that what is going so wrong in China that they're just unable to contain the cases.
I think there are several reasons. One of the most important reasons is the Chinese society is not prepared at all. And now the government, instead of trying to slow down the process of infection and the peak of the infections, they are actually purposely accelerate this process. Like a city called Wuxi City in Jiangsu province even got criticized because their speed of infection is too low. So the overall strategy of the CCP now is they want to exchange lives with time, or they want to trade people's lives for time. They want this thing to get over as soon as possible so that they can resume production as soon as possible, preferably between March next year. So in other countries, when people get sick, when people get infected, they quarantine themselves at home. They don't go to work to spread the virus. But in China now, they are requiring anybody who is already infected, but as long as you don't have very severe symptoms, you have a very minor symptom, you still need to go to work or go to school. That purposely spread the virus.
Yeah. And you know what is problematic, Jennifer, is that this isn't the first time that we're seeing numbers being suppressed. As far as the origin was concerned, you had China denying all of that. Then when the, pandemic broke, as far as numbers were concerned, that was hidden. And now once again, not telling us what the real picture is. And that is why globally countries are today worried of what the global fallout will look like. What is the current situation in the bigger cities like Beijing and others?
In Beijing, I think we have very good reason to believe that thousands are dying every day, but they are not reporting any single-digit number like 5 cases, 7 cases. So that is totally unbelievable. So and another problem now is many people are reporting very high rate of severe cases and lung damage. I saw people post their CT scan imaging of the lungs, which shows very severe lung damage. And they are saying this is not like Omicron at all, but more like in the first wave, what happened in Wuhan. So, of course, people are, trying to put out all kinds of theories of why this happened. Some say we have a new virus, or some say something other is not Omicron, or something new.
So this is interesting of what you're saying. That a lot of people are actually saying that this might not be Omicron, but this is similar to what we'd actually seen in the first wave. But I've been seeing some of the videos that you're putting out, Jennifer, and they're heartbreaking. Today we saw a father kneeling in the hospital, and this was again a video that was put out by you, wanting care as far as his children is concerned. A couple of days ago we saw a daughter running pillar to post, being shunned away from hospitals. Has the medical infrastructure completely crumbled because of this egoistic zero COVID policy that the authorities wanted to go forward with?
Yes, I think so, because the jump of the cases, the hospitals, one reason is the hospitals are overwhelmed anyway. Another reason is many of the medical professionals, they themselves also got sick, not only in medical industry, but in many other industries, like the carrier, goods are piling up because nobody is delivering. I just saw a social media post saying that more than 80% of their company are all sick. 80% are all infected and sick. So the two reasons, combined together, I think that made the situation is really worse. And one girl said, they try call the ambulance. And the ambulance said, now there are 10,000 people waiting. That's in Beijing. So there's no possibility and all that she could get an ambulance service for her mother-in-law, and she died at home.
Well, as we said, these stories continue to come out of China every single day. And the unfortunate part is that we'll never know what the real picture looks like. Unfortunately, I'll have to leave that conversation there. I appreciate both our guests taking our time and joining us here on CNN News 18. We're getting some breaking developments coming in. And this is what we're picking by means of sources. Bharat Biotech's nasal vaccine will be introduced on COVID by next week. This is being brought as a booster dose for 18 years and above. The pricing is yet to be decided. The DCGI has given a green signal to the completion of the trials. The formal announcement to be made in the coming days. My colleague Sharon Elizabeth is getting us all these details. Sharon, what are you picking up? What are you picking up as far as the timeline of this vaccine is concerned?
Well, in coming few days, it will in fact be formally announced as to when it will in fact be reflected on CoWIN app and when people can go and get themselves inoculated. This particular intranasal vaccine is called BA.5.2. And this is in fact a replication deficient of chimpanzee endovirus, which is for people above the age of 18 years and above. So this is going to be part of the inoculation, the vaccine inoculation for 18 plus age group, and it could be in fact in coming days a formal announcement will be made by DCGI. But as of now, they have completed 3 vaccine trials, and they are in fact going ahead with the DCGI will be announcing formally as when it will be available for the commercial market.
So essentially, Sharon, what I'm trying to understand is till now, whatever booster we took was the same vaccine that we'd taken for the first and the second jab. How will this work with this particular nasal vaccine? Sharon, can you hear me? Okay, we'll try and reestablish that connection with my colleague Sharon, but in the meantime, we are getting some other breaking developments coming in as well. And this is the update coming in as far as the high-level meeting that was chaired by the Prime Minister. The Prime Minister chaired this high-level meeting to review the status and preparedness of the public health response to COVID-19. The Prime Minister cautions against complacency, advises for maintaining strict vigil. The Prime Minister has emphasized the need for strengthened surveillance with focus on genome sequencing and increased testing. States have been advised to ensure operational readiness of hospital infrastructure, advise adherence to COVID-appropriate behavior, which means including a mask, stressed on the precaution dose vaccination for the elderly and the vulnerable population. The Prime Minister appreciates the selfless service of frontline workers and corona warriors. So the Prime Minister also highlighting that you need to go back to the basics because we cannot let our guard down. Well, with that, it's a wrap from my side. News continues here on CNN News 18. Plain Speak is up next.